السلام عليكم شباب. اليوم محاضرتنا على موضوع فقر الدم الانحلالي. Our subject now to discuss about the hemolytic anemia, and the target group is the fourth year medical student. Objective for this lecture is to learn about the sign and symptom and management of the hemolytic anemia. هسه شباب عددوا لنا انواع الفقر الدم عند الاطفال. يس ايرون ديفيشنسي انيميا. نعم. سيكل سيلز انيميا. ثلاسيميا. نعم. ميجال بلاستيك انيميا. يس فول ديفيشنسي انيميا. زين، من يحكي لنا على موضوع الايرون ديفيشنسي انيميا شباب؟ فقر الدم نتيجه لنقص الحديد. ليش يحدث؟ نعم
دكتور، احنا مساله الايرون ديفيشنسي انيميا may characterize to different area. Maybe because a nutritional effect, like there's a problem in like
yes.
malnutrition or
malnutritional, yes,
or maybe the child is neglected.
Yes.
So that it results because the parents are not taking care of the child.
Yes.
It will lead to iron deficiency anemia.
Yes.
And it may be related to the time of making the nursing, or the type of the milk he takes, is it breast milk or artificial, and in the area of the 6 month.
Yes.
Because as we all know, after the 6 month, he will need to take other food, not just the milk, to adjust the iron need. So he will not make an iron deficiency.
Thank you very much. Other types of the inheritance anemia, yes? Like the thalassemia? Yes. 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 Other types of the anemia.
ممكن نقول البيرنيشيوس انيميا.
يعني احنا بدنا نحكي على ناخذ ان جنرال، يعني بدنا نحكي على موضوع الايرون ديفيشنسي انيميا، الانهيرتنس تايبس اوف ذا انيميا، الميجالوبلاستيك انيميا، and in addition for the aplastic انيميا. زين، ذكر زميلكم انه الايرون ديفيشنسي انيميا يعني ممكن احتمال مال نوتريشنال، يعني الام زين ما قاعد تعطي كميه كافيه من الحديد للطفل، وبالتالي الطفل راح يصير عنده فقر دم. لكن احنا ايضا خلال فتره الانفنسي يعني يمكن احتمال فيزيولوجيكال انيميا ديفلوب. زين، يعني اما الام مثلا ما قاعد تعطي، احنا وشود بي سبلمنت وذ ايرون during the infancy، يعني هذا تعرفون انتم الايج مالتها، زين ناخذها بنظر الاعتبار. اذا يس
دكتور، خلال حياه المستشفى اللي حضراتكم تداومون بيها، شلون تقدر تفرق ما بين انواع الانيميا اللي تجيك مثلا الاستشاره؟
طبعا احنا when set the patient for the CBC complete blood count and to see the level of the hemoglobin is less than the physiological level and set for the blood film. نشوف يعني what is the type of the anemia. It is the hypochromic macrocytic, it is normocytic, فنعرف انه. وبنفس الوقت طبعا اذا كان iron deficiency anemia set for the serum iron and in addition for the total iron binding capacity. زين، راح يكون عندنا less of the iron. زين، وبالتالي نشوف انه شنو السبب الكوز of the iron. يس. طبعا هو طبعا البالور الفتيك، احنا طبعا هذا الرابط زين راح اعطيكم اياه ان شاء الله بالمحاضره يبين لكم الساين على سبتم. هسه راح نحكي على موضوع احنا الهيموليتيك انيميا زين كوحده من التايبس اوف ذا انيميا اللي هو فقر الدم الانحلالي. زين. Now hemolysis can be defined as the premature destructions of the RBC cells. As you know, the lifespan of the RBC cells is about 110 and 120 days, and is due to the premature of the destructions of the RBC. This will lead for the overstimulation of the bone marrow to produce new RBC cells new. Okay? Now, this is when we have hemolysis happen into the blood. This will lead for the reflected for the blood and elevated the reticulocyte count in the blood. And the reticulocyte count also is elevated not only for the hemolysis only, but also for to the blood loss or after short period from the replacement therapy for the iron and vitamin B12 or folate deficiency. من يصير فقر الدم الانحلالي، زين ايش راح يصير عندنا؟ راح تظهر عندنا مجموعة biochemical changes will happen in the urinary or fecal or chemical alteration, and this will lead for the increase the unconjugated bilirubin and increase the lactic acid dehydrogenase in serum and increase the fecal and urinary pyrogen and in addition for the hemoglobin urea. زين هذا من راح يصير عندنا هيموليسيس وراح يصير عندنا انحلال بفقر الدم او انحلال عفوا red blood cells. This is will lead for the reticulocytosis and increases the erythropoiesis. And this is will lead for the over expansion of the bone marrow is due to the destructions of the RBC cells. هذا طبعا راح نشوف هنا prominent of the frontal bone, and as you see prominent of the frontal bone and the broad of the cheekbone, and in addition for the over expansions of the bone marrow, and will lead for the hair on the hair on and on the skull X-ray. Hemolysis can be classified as whether it is abnormality happened into the membrane or in hemoglobin, or whether it is the cellular or extracellular, as you know. Now, one of this disease of the lead for the hemolysis, it is the hereditary spherocytosis. The hereditary spherocytosis, where there is abnormality into the red blood cells membrane and change for the cytoskeleton, and this is will lead for the RBC cells has become more spherocyte, and also it is reduced the diameter if we compare with the normal RBC cells. And this is more common in among the person of the Northern European origin. Now, what is the etiology of the hereditary spherocytosis? The most common causes, it is the inherited types, it is the autosomal dominant, is about the 75%, and 25% there is no family history for the hereditary spherocytosis. Now, this is, as you know, when we have to change into the red blood cell skeleton for the membrane of the RB cells, and this is will lead to more spherocyte and more destructions of the RB cells if we compare with the normal type of the cells. Now, what is the clinical manifestation of the patient with the hereditary spherocytosis? Sometimes it happened during the neonatal period. The patient will be presented with the anemic and hyperbilirubinemia, and in addition may be required for the photo or exchange transfusion. And some children, it is asymptomatic, but others maybe complain from anemia, in addition for pallor or jaundice or fatigue or exercise intolerance. And after the infancy, where there is simply is a large, may become one of the manifestation. Now, what is the complication of the patient with the hereditary spherocytosis? One of this is hemolytic crisis, precipitated by the viral infection, or a plastic crisis, where dramatic fall in hemoglobin level is due to the affected with the pyrovirus B19, or folate deficiency, and sometimes maybe mixed with the megaloblastic anemia, as mixed of the hereditary spherocytosis may be diagnosed by the osmotic fragility. Now, what is the lab finding in patient with this the hereditary spherocytosis? Hemoglobin level is about 6 to 10 gram per deciliter, and also where there's MCV is decreased and red distribution with it is elevated. احنا هسه سالنا قلنا احنا فقر الدم الانحلالي زين، واحده من الشغلات اللي احنا قلنا عليها او عددنا انواع الفقر الدم، قلنا مثلا على سبيل المثال الايرون ديفيشنسي انيميا، او حكينا على موضوع الميجالوبلاستيك انيميا، وحكينا على الثلاسيميا وعلى السيكل سيلز انيميا. لذلك اي طفل احتمال انتم تشوفوه عنده فقر دم، we send for the complete blood pictures and send for the blood film. And what is the types of the anemia? It is the hypochromic anemia, it is normochromic anemia, or macrochromic anemia. Now, we can show, this is for the diagrams for a patient with the regarding for this is for this spherocyte or hereditary spherocytosis. تشوفون هسه انتم عاده الريد blood cells الحقيقه if we compare with the adults it is a small red blood cells, and also it's more spherocyte, and the hyperchromic if we compare with the normal blood cells, as you know. Now, how to treatment of this patient? We can be folate acid supplement, 1 milligram per day, and leukocyte packed red blood cells transfusion for severe crisis, and splenectomy done for this patient for moderated and severe of the cases. لازم تخلون بالكم انه عادة انه ال 80% زين احنا عادة splenectomy should be cried not only cried in the early of the cases يعني عادة not before 5 years of age. Now, others of the disease may be with the presented with the hemolytic anemia أو يسوون عادة فقر الدم الحلالي هو السيكل سيلز أنيميا. السيكل سيلز أنيميا الحقيقة where there is disorder الحقيقة for the hemoglobinopathies and the red blood cells is become more stick and more rigid, and this is will lead for the myocclusion of the blood vessels and may be affected for the different part of the body. As you will show, when we show this is for the red blood cells, it's become more sickling, and the can be compared if we compare with the normal red blood cells. This is for the sickle cells anemia. Now, what is the clinical features of the patient with sickle cells anemia? Now, there is painful crisis, and there's splenic sequestration, and acute chest syndrome, and aplastic crisis. Now, the factors that will precipitate of this crisis, there is different factors for precipitated for this crisis, like for the infection, low oxygen tension, and dehydration, and acidosis, and extreme physical exercise. This is for the vaso-occlusive, where there is obstruction for the microvascular, is due to the rigid of the red blood cells, may be affected different part of the body, like the abdomen and the bone and joint and soft tissue, and also may be affected not only for the long bone, sometimes may be affected also for the small bone, like the metatarsal or metacarpal bone. And this is declititis, will painful swelling of the hand. Now, what is the splenic sequestration? As you know, where there's abnormality in the red blood cells, it is more sickles. This is will lead for the vaso-occlusive occur in the spleen, and the microvascles is blocked, and this is will lead for the accumulated of the blood in the spleen, and this is will lead later on. It is threatened for medical attention, or maybe increase the risk of the infection bicapsulated of the organism. Now, regarding for the acute chest syndrome, commonly characteristic by the chest pain and the fever and the cough and dyspnea and pulmonary infiltration, may be medical emergency commonly precipitated by the chest infection. Now, this is for the aplastic crisis. Worsening basal anemia is due to the infection with the pyrovirus B19. طبعا هذا احنا مثل ما قلنا انه increase the incidence of the infection, and in addition maybe is due to the accumulated for the blood into the spleen, and this is will lead for the develop different complication. This is for this slide we can show the sickle cells anemia, where their sickle cells is, if we compare with the normal cells, it is different. This is a normal blood cells, and this is the sickle cells, and this is will lead more rigid, more stick, and this may be developed in the blood vessels and lead for the occlusive of the blood vessels, and then we have development different of the complication. Now, hemolytic crisis may be associated with breakdown of the RBC cells, and maybe coexist with the G6PD deficiency. طبعا, as you know, the G6PD deficiency is the recessive X-linked disorder is due to deficit into the enzyme required for the formation of glutathione for the regarding for the red blood cells. Now, what is the clinical manifestation? الحقيقة, the clinical manifestation as the major devastating manifestation is stroke, commonly is due to the ischemic or hemorrhagic rupture of the aneurysm, and convulsion may be developed, or paraorbital of the infection. This is the diagram يسبب لنا يشوف لنا عادة diagram. We can show the cells or blood vessels where there is micro-occlusive, where it's due to the sticks of the red blood cells, and may become occlusion, and maybe develop the different of the complication. الdiagnosis طبعا مثل ما تعرفون عادة احنا الاتاك diagnostic clinically there is no gold standard for diagnostic test, but the hemolysis can be presented, although in addition for the painful crisis is one of the clinical manifestation, and same for the hemoglobinopathy or hemoglobin electrophoresis, and to diagnostic the hemoglobinopathy for the red blood cells. هاي هم other diagrams الحقيقة يشوف لنا إنه الابنورماليتي اللي تصير blood cells و develop of the other complication for the sickle cells. And this is for the lab investigation. This is for the lab investigation regarding for the screening and diagnostic confirmation and scaling test الحقيقة this hemoglobin for electrophoresis, but not for infant, can be used for the after 6 months of the age, and in newborn screening for these types of the high performance liquid chematography. Treatment, treatment is aimed to prevent of the crisis, to control of the complications. الحقيقة ما عندنا، لكن اكو احنا عادة بالعلاج بالنسبة لموضوع السيكل سيلز انيميا يسوون بون ترانسبلانت، بون مورو ترانسبلانتيشن، لكن هذا الحقيقة هم عدة مضاعفات عادة يصير من ضمنها الالتهابات، ومن ضمنها عادة الرفض اللي يصير بالنسبة لموضوع الزرع النخاع العظم. This is طبعا for prime anesthesia children إذا صار عندهم infection طبعا عادة sent for the complete blood count and blood culture taken from the patient زين، و start for the antibiotic عادة treatment to prevent of the infection، وعادة الchildren لازم should be follow up زين، دائما يسووا له follow up ويشوفوا ال level of the hemoglobin and also checking for if there is any infection presented or not. هذا الحقيقة رابط for the hemolytic anemia، ممكن تدخلون عليه وتشوفوا انتم، هذا الرابط يبين لك الساين and symptom and how to management of the hemolytic anemia. This is for short information about the hemolytic anemia.
Hemolytic anemia is
I'll give you a reminder on this video, please.
Are destroyed and removed from the bloodstream before their normal lifespan is up. A number of diseases, conditions, and factors can cause the body to destroy its red blood cells. Hemolytic anemia can lead to various health problems, such as fatigue, pain, arrhythmias, an enlarged heart, and heart failure. There are many types of hemolytic anemias, some of which are inherited, and others that are acquired. Inherited hemolytic anemias include sickle cell anemia, thalassemias, hereditary stereocytosis, hereditary erythrocytosis,
This is a type of hemolytic
glucose
anemia,
phosphate dehydrogenase, or
which will be inheritance and abnormality in the enzyme causes.
pyruvic kinase deficiency. Acquired hemolytic anemias include immune hemolytic anemia, autoimmune hemolytic anemia, alloimmune hemolytic anemia, drug-induced hemolytic anemia, mechanical hemolytic anemias, paroxysmal nocturnal hemoglobinuria. Certain infections and substances can also damage red blood cells and lead to hemolytic anemia. Causes. The immediate cause of hemolytic anemia is the early destruction of red blood cells. A number of diseases, conditions, and factors can cause the body to destroy its red blood cells. These causes can be inherited or acquired. Sometimes the cause of hemolytic anemia isn't known. In inherited hemolytic anemias, the genes that control how red blood cells are made are faulty. Different types of faulty genes account for the different types of inherited hemolytic anemias. In each type of inherited hemolytic anemia, the body makes abnormal red blood cells. The problem with the red blood cells may involve the hemoglobin, cell membrane, or enzymes that maintain healthy red blood cells. In acquired hemolytic anemias, the body makes normal red blood cells. However, some disease, condition, or factor destroys the cells too early. Examples include immune disorders, infections, and reactions to medicines or blood transfusion. Signs and symptoms. The most common symptom of all types of anemia is fatigue. A low red blood cell count can also cause shortness of breath, dizziness, headache, coldness in your hands or feet, raw skin, gums, and nail beds, as well as chest pain. Symptoms of hemolytic anemia include jaundice, pain in the upper abdomen, leg ulcers and pain, a severe reaction to a blood transfusion. Treatment. Treatments for medicines, plasmapheresis, surgery, blood and marrow stem cell transplants, and lifestyle changes. People who have mild hemolytic anemia may not need treatment, as long as the condition doesn't worsen. People with severe hemolytic anemia usually need ongoing treatment. Risk. Hemolytic anemia can affect people of all ages, races, and sexes. Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.
This is the reference for our lectures from nursing textbook and hematology principle and others. And هذه فد الحقيقة فد معلومة since the knowledge is the key for success. Never to stop studying, gaining new information. Always we should be always studies and to gain the new information. And this is for QR code. هذا QR code اللي تدخلون عليه وتدزوا لي الجواب عن طريق الايميل مالتي او عن طريق الجوجل كلاس روم. And thank you for listening.